Before we dive into the session, I'd like to acknowledge our land. George Brown College is located on the traditional territory of the Mississaugas of the Credit First Nation and Indigenous peoples who have lived here over time. We are grateful to share this land as treaty people who learn, work, and live in the community with each other. So moving into the intent of our session, the session is an opportunity to further help you in getting answers to your vaccine-related questions. So these questions may be related to safety and efficacy of the vaccine, or even to the GBC vaccine policy itself. With that said, I'd like to take this opportunity to introduce to you our expert panel for today. Today we have with us our very own Dr. Chris McGrath, VP of Student Success. He really doesn't need an introduction, but he's here today to answer our questions related to the internal vaccine policy. We're also very pleased to have with us today Mr. Howard Goldblatt, Goldblatt Partners, LLP. And finally, Dr. Alexa Cataray, Infectious Disease Specialist, Toronto Public Health. Thank you all for taking the time to join us during today's session. And now, Dr. Cataray will take us through a very short discussion on the safety and efficacy of the COVID-19 vaccines before we open up to the question and answer period. Dr. Cataray is a public health and prevention medicine specialist with broad experience in the municipal and provincial level, coupled with a track record of delivering high-quality strategic projects locally and internationally. She's completed medical training at McMaster University and specialty training at Queen's University. She's completed her master's degree in public health at the University of Toronto. Dr. Cataray is committed to addressing inequality and meeting the needs of diverse communities. She's professionally interested in communicable disease, emergency preparedness and response, and governance and ethics as it relates to public health issues. With that said, Dr. Cataray, I turn things over to you to get us started and take us through the slides for the COVID-19 vaccine information.
Thank you very much for the kind introduction. I'm here from Toronto Public Health to share some information and to perhaps address some concerns in advance with respect to what COVID-19 vaccinations are and how they protect your health. And I want to start by highlighting where we are in terms of the pandemic. I know it's been a long time. It feels like we have been living this life for many more years than the almost 2 since the pandemic began. And what has changed over time is the kind of virus, so the variant of virus, which at this point in time presents some additional risk. We've been talking a lot about a Delta variant, which is a mutated strain of the COVID-19 virus that spreads more easily and can cause more severe illness. I think it's really important before we even move to talking about vaccination to note that all of the public health measures that are in place taken together are really important to protect everyone's health. And they include the same things that you've been doing over and over again: wearing your mask, keeping distant from others, washing your hands. And what we have now that we did not have to use a year ago in order to combat the virus is vaccination. And vaccines prevent against severe illness, against hospitalization, from all of the strains that we know about of COVID-19, including the Delta variant, which is the cause of most of our cases at present. Speaking about vaccination in general, vaccination is a safe, effective, and probably the best way to prevent a number of diseases, and most specifically the one we're talking about today, COVID-19. It takes at least 2 weeks after one's complete series of COVID-19 vaccines in order to be fully protected. And as more and more people come to be vaccinated, our entire communities are safer and better protected, something we talk about it in terms of community immunity. And what we really want to emphasize is that, you know, your school community is part of the whole community in the city of Toronto. And we need everybody, because your school community doesn't exist in a bubble, in order to work towards vaccination to bring the risk down for everyone involved. After people get vaccinated, the risk of becoming ill with the COVID-19 infection is lowered, as is your risk of, if you do happen to become ill, giving that infection to someone else. Given that information, again, we want to emphasize that all of the other public health measures, most especially staying home if you're feeling unwell, are still really important. So a little bit about how COVID-19 vaccines work. The vaccines work by giving your body a set of instructions. So you get vaccinated, and the information encoded in the vaccine most commonly uses something called mRNA technology, which has been around for more than a decade. And it tells your body to make a small protein that's found on the surface of the virus that then your body's own immune system reacts to in order to protect you. And the mRNA, that piece of coding or information, along with the spike protein, the piece of virus that it tells your body to make, break down and are eliminated from your body within a couple of days of you receiving your vaccine. We've heard a number of times, one of our most frequently asked questions is, if you've already had COVID-19, do you still need to have the vaccine? And the answer to that question is yes. The most up-to-date scientific evidence from our experts indicates that while there is some immunity from being infected, the longest lasting and most reliable immunity comes from being vaccinated. In terms of risks, I think it's important to frame this in the context of the risk of COVID-19 infection in general. And your risk of becoming ill, becoming significantly ill if you get COVID-19, far outstrips the risk presented by the vaccine. All of the COVID-19 vaccines that we have approved in Canada are very effective. They do what they're meant to do, which is protect you, and they are safe. There have been some reports of some specific side effects like myocarditis or pericarditis, which is an inflammation of the heart, with the mRNA vaccines, which are Pfizer and Moderna, that are experienced mostly by teens and young adults. Thus far, all of the cases that have been reported to us in Toronto and in Ontario have been mild, and they've resolved. And there are symptoms that are listed here in the slides. And if you had any of those symptoms following receiving a vaccine, those would be reasons to go and see a healthcare provider. And this is a really rare side effect, but I think one that's important, particularly given the population that we're talking about, so mostly younger adults, and to be aware of. That said, the risk of this particular side effect is still extraordinarily low. I think it's important when we, again, think about vaccines in general to think about where we're receiving our information from as well. So this is a great example of a forum in which you can receive some reliable information. The Toronto Public Health website also has some good, reliable information, but we want to make sure that everybody has access to accurate, complete, and scientific information when considering whether or not to be vaccinated. And so this outlines, you know, that one might consider the source and whether or not it's credible, and look a little bit beyond just a headline and into the story if you're reading a news article, and to look at the source and figure out if they're providing true facts or something based on opinion. And there are, again, resources available from us at Toronto Public Health, from the province of Ontario, that you can use as a double check. And so if you have questions, our telephone number is there. It's 416 888-338-7600. And we have availability for people to help connect you to resources if you wish to be vaccinated. There's also a wealth of information available on the toronto.ca/COVID-19 website about COVID in general and vaccines more specifically. That's great. We don't have to go through these now.
Thank you, Dr. Cataray, for that information. Megan, I'd like to turn it over to you to further introduce Mr. Goldblatt.
Thank you. And thank you, Howard Goldblatt, for joining us. Howard comes from 40 years of experience, and he represents a multitude of trade unions and their members and every conceivable labor law matter. He's an advocate. He's questioning witnesses or making submissions to an adjudicator or a court. Throughout his career of grievance arbitration has always been a large part of Howard's practice. He has argued and settled more grievance arbitration cases than most people have had hot breakfasts. So, and when a client needs someone to help them negotiate or arbitrate terms of a collective agreement, they know Howard is the best deal. Howard has also represented trade unions at the Ontario Labour Relations Board in unfair labor practice, illegal strikes, and duty of fair representation. In addition, he frequently represents clients in adjudicatable review applications and appeals. Whenever the case, Howard knows that the outcome matters to the union and to their members, and he applies the same analytical and strategic and advocacy abilities to all matters. So I welcome Howard and thank you for joining us.
Thank you, Megan. I guess it would have been simpler and faster just to say I've been around a long time, and I've had a lot of experience. I'm going to be as brief as I can be because I think it's more important that we actually listen to what your questions are and we respond to your questions. And I'd like to thank the doctor for a very helpful overview of the vaccine. I want to emphasize that I'm not giving legal advice with respect to any particular collective agreement or with respect to any particular contractual relationship. What I'm doing is reflecting what I understand to be from my colleagues, both within our firm and outside of our firm, the generally held view with respect to vaccine mandates requiring that the individual be vaccinated. First is that it is generally speaking regarded as being a reasonable exercise of employer rights. And that is whether it's under a collective agreement where there might be some restrictions or otherwise when there are fewer restrictions if you're not covered by a collective agreement. Secondly, there are exceptions, and there are essentially two exceptions. Number one is that there needs to be appropriate safeguards in place to protect any confidential medical information. That's number one. And number two is that the mandate is always subject to human rights exceptions. And the primary exception there is a bona fide medical exception, a religious exception, and to some lesser extent, and I mean very lesser extent, a creed exception, which is much more difficult to establish. But if those exceptions are established, then the issue is whether the individual can be accommodated and if they can be accommodated to the extent of undue hardship. Let me also say that none of the policies require that you be vaccinated. What they require is that you be vaccinated and or disclose. If you don't disclose your vaccination status, generally speaking, you're deemed not to be vaccinated. But if you choose not to be vaccinated or you choose not to disclose, then there are consequences. And the issue will obviously be in any particular case, what are the consequences and are they appropriate? But if human rights issues have been addressed and safety has been taken into account with respect to medical disclosure, then generally speaking, there's a very wide latitude with respect to the requirement to get vaccinations. And so let me just end by saying what we say, and when we're providing advice, if you can be vaccinated, you should be vaccinated. If you can't be vaccinated, you better be able, I say this without any threatening aspect to it, but you better be able to establish why you can't be. So let me just stop there, because as I say, it'd be very much more interesting to listen to your questions and hopefully to answer them.
Thank you, Howard. Nadia, I think we're going to go into the Q&A.
Yes, if you have questions, please type them into the chat, and Megan and Paul will address your question, and we'll have the best person on our expert panel to address them.
We also have there's a private function if you want to send Paul Petrie or Megan Carter a question and you didn't want your name on it, feel free to private message us and I can read the question out loud, no problem.
So we have a question in the chat that I think Dr. Cataray might be the best person to answer. If the vaccines work, why do we use masks?
I think that's a good question. So, what we are trying to address is layers of protection. So just like you wouldn't get into a car and not use your seatbelt because the airbag works, we're talking about many, many layers that we're trying to put between you and becoming ill. So while the vaccines work, there is no medical intervention that is 100% perfect. And so given that we know that people do become ill and also have the potential to spread that illness to others, we want to reduce your risk as much as possible. And so this is about putting, as many things between you and your family becoming ill and the virus as we possibly can.
There's another question, and this might be for Chris and Howard. Who is liable for vaccine side effects? Is the college taking full liability?
Well, I certainly can't answer for the college as to whether they're taking full liability or not, but the question really is, what is the vaccine side effect? How does it impact an individual with respect to their employment and so on? And, it might well be covered by your sick leave provisions under your collective agreement. We're unclear as to whether it would be something that would fall within the scope of the workers' compensation legislation. But I think that is, if I might say it, a relatively minimum concern. I think Dr. Cataray's made it clear that the vaccine side effects are relatively minimal. And I think they would have to be addressed depending upon how they arose, what they did, and what impact they had upon your particular employment.
I would agree with that.
I also got a question here that talks about, they're curious about Ontario as compared to BC, for example, to their understanding that they do not have any exemptions such as religious ones. Does not BC not have a human rights code?
Yeah, BC has a human rights code. There's also the Charter of Canadian Charter of Rights and Freedoms, which also has exemptions that are built into it. I don't want to speak for why the decisions were made in BC, but I can tell you very much so that Ontario has a human rights code. It's a very active and a very important piece of legislation. And the protections under the code will be part of whatever needs to be accommodated within any mandatory vaccine policy across the province.
Thanks. There's a question from someone that's asking if GBC is willing to let people know how many people are not vaccinated on campus, the percentage.
Right now, that number is hard to discern just because of, at this point in time, if someone enters the college, they can do so either having shown proof of vaccination or a negative rapid antigen test result. So right now we're only tracking entries, but it's estimated that about 20 to 25% of individuals who came onto campus during the first week of classes were not vaccinated based upon that traffic flow. So we don't have an exact number. And we're also not at this point in time tracking vaccination rates of individuals who are not coming to the college campuses.
Thanks, Chris. There's a question about, perhaps the doctor might be able to help with this one too. There's a question about the efficacy declines after 6 to 8 months and having to take a booster shot. So there's a two-part question that might be interesting for folks, like about booster shots, and will GBC employees be mandated to get those shots? Maybe someone else would have to answer that part.
Maybe I can start. So the information about vaccine efficacy and how long someone's protection against COVID-19 from this series of vaccines lasts is still very much an area of science that's being explored. I don't think that we actually have definitive information to suggest that everyone's immunity wanes over a given period of time. I think it's helpful again to remember that these vaccines are very new. They've existed for less than a year for the COVID-19 vaccines specifically, even though we know that the technology is not new. And so in terms of longer term outcomes or studies, it's an area of science that's progressing as we are, as people become vaccinated. And so if, for example, you required an additional dose, then that information would be made available at the point in time when our provincial and federal health colleagues make that determination.
We also have another question here. It says, what if partner, wife, husband, I'll add family member in there, is health compromised and would qualify for the medical human rights condition? What happens if the employee brings home and spreads the illness to the family? What may be done to avoid this situation, such as an employee remaining online teaching? I don't know if there's anybody who can respond to that question.
I'm just reading it again here, Paul.
We might be able to ask Howard more general. Is there a legislation under human rights where someone you live with is vulnerable and therefore you would like to get an exemption to work from home? I think that's the question. Correct me if I'm wrong.
Yeah, generally, there is an exemption for family status. That you can't be discriminated against based upon family status. But I honestly don't know the answer, which is one of the things I'm prepared to do. Admit when I don't know the answer as to what the policies might do with respect to someone whose family member is health compromised. I'm not sure I appreciate, though, that if the individual who is not an employee is health compromised and doesn't get the vaccine, I don't know why that would prevent the employee from getting the vaccine. And I would have thought that, in fact, the employee would be in a better position to protect the vulnerable person who's at home by getting the vaccine. So I really don't appreciate what the thrust of the question or the concern raised by the question might be.
I have a question for the doctor. It was mentioned that the vaccinated people transmit less virus to the others that are vaccinated. Can you explain why? If you can get sick, vax or not vax, why is there a difference in transmitting the virus?
Yeah, so much like many other vaccines, this vaccine is something that reduces risk. So the way I sometimes explain it to people is like it gives your body instructions and information so that the next time it sees the same virus, it knows how to go and reduce or mitigate that infection. A vaccine isn't a treatment, so it's not something that you take when you are ill in order to get rid of that illness. It's a preventive measure. So they're sort of preemptive instructions to your immune system to say, this is something that's not good that we need you to deal with. And those instructions are dependent on how the virus mutates over time. So you'll see that we talked about different variants, and you may or may not get a complete immune response with the vaccine, but it in almost all cases reduces your likelihood of having a severe illness. And so most people achieve somewhere between 85 and 95% protection with their series of vaccines.
Thank you. There's also a question, I don't know if this is for Chris, and maybe Howard can address some of the legal language in this. And this is regarding the Synergy Gateway, I'm assuming privacy and confidentiality policy. It says, can you expand on, quote unquote, among other things in the point below, is part of us registering our vaccination status with Synergy Gateway? What other pieces of information could be gathered, collected, et cetera, by this third-party service? And it states from the policy, I understand and consent to Synergy Gateway gathering my personal demographic information and personal health information about, among other things, my COVID-19 vaccination status. Collectively, my personal information.
So that data information provision. So first of all, I'll say that when we were looking at and negotiating with Synergy Gateway, we consulted with the college's legal counsel extensively, who were instrumental in putting forward a contract that ensured that both Synergy and the college were doing their utmost to protect people's privacy and that the data was secure. The provision around, among other things, could be things like, let's say, for some reason there was a need to know what date and time I logged in to provide my vaccination information. It would be operational data relating to the individual's transactions with the system that would be captured under the nature of, among other things. At this point in time, the only data that's being shared is the data that you provide by virtue of having uploaded the PDFs of your vaccination receipts from the provincial website. And so the information provided on there as well will also be captured under, among other things.
There's a fairly long question, but I'm going to summarize. Hopefully I do a good job.
Can I just add this, Megan? And I don't know what the general view is, but there are issues being raised as to whether a vaccine status is actual medical information, as opposed to yes, I do or no, I don't. We take the position, just to be clear, we take the position that medical information to be protected should be as broad as possible and it should be included. But I know that there are other legal counsel who are on the employer side who may question whether in fact it's that broad, but we would want to protect it.
Thanks, Howard. There's a question that's very lengthy, but I'm going to try to get to the meat of it from you, Howard. They're talking about ethical health rights when mandates such as the one GBC has established. So basically, how do we make sure they're not infringing on ethical health rights when we establish such vaccine mandates? Not sure if you could help with that. Sure.
No, I mean, I've heard this raised, you know, with the consent and issues about medical experimentation. There's references to the Geneva Code, which I've never really, I mean, I understand what it is, but I've never seen its prominence as much as I have certainly in the last 3 weeks, 2.5 to 3 weeks. No, I'm going to repeat what I said before, is that there is no requirement that you have the vaccine. If you choose not to have the vaccine and therefore not to have the medical procedure, that's fine. But there are going to be consequences. There are going to be consequences that are beyond just the employment consequences. There are going to be consequences that will, as of September the 22nd, be community consequences. There are going to be issues with respect to whether you can attend the Blue Jays playoff game without being double vaccinated. I mean, the fact of the matter is that within our society, making reference specifically to the language that is used in the Canadian Charter of Rights and Freedoms, everybody talks about our charter rights. One of the things that's in the charter is that the question is whether there is a limit which is reasonable in a free and democratic society. And it's the society that one has to look at and what is reasonable within that society. And I think that the medical evidence, and Dr. Carteret could speak to this much better than I can, would establish that it is reasonable within that society to require the vaccination for various purposes. If people choose not to be vaccinated, there will be consequences. And our job is to determine whether those consequences are appropriate in the individual circumstances.
I would also add to that, if I may, there's nuance in people's understandings of rights versus responsibilities versus rules. And so, you know, indeed, there is a health right to not get the vaccination. But as Mr. Goldblatt said, there are consequences to that. And one of those consequences is that the college has a rule that in order to come on campus, you must demonstrate that you're fully vaccinated. So the policy doesn't relate to a violation of rights. The policy is actually an operating rule for the organization. And as a college, we have a responsibility under legislation to put provisions in place to safeguard our community around their health and safety. So the emergence of this policy comes from sort of this space where all three of those things come together. At the same time, when you go and get a vaccine, you are doing so by virtue of having provided consent to that medical procedure. So the interaction where an individual would get that understanding about efficacy, et cetera, that is cited in the question as an example, that's actually at the medical intervention. That's at the point of getting the vaccination. That is not at the point of the college working through the rules of its operation. Now, we do, within the context of being an educational institution, have a degree of, dare I say, responsibility for ensuring that our community members have access to that information. And we do that by making modules available, by making sure information is available. But consent has to be provided in order for that vaccination to be administered.
Thank you. I just have a question here regarding religious exemptions. I don't know if Howard and Chris can answer this. What does that look like? What is the process for filing those at the college? So, and how are they adjudicated?
So the process for doing an exemption, it's the information on the process is on the college's COVID-19 vaccination information website. And so what you would do for a religious or creed-based exemption, there's a link to a form that you'll complete. The form that then gets submitted, and the information is being collected through my office. And then there's a small group of individuals from the college who review the request and also review it where appropriate with legal counsel to then render a decision on the exemption request.
Yeah,
Somebody's
I'm
asking.
not, sorry,
Go ahead.
I would just say that that's the college's way of doing it. Various other employers are requiring different things. It really depends upon what's being put in place. But so I'll defer to Chris with respect to the college.
Someone's asking if they could get a list of the exemptions. Like what are the exemptions in detail? So what medical conditions, what religious are being exempted?
So that information is actually provided to our community members, again, on the vaccine information website. So there's on the vaccine exemption form, for example, for religion or creed, there's a link that's provided to the Ontario Human Rights Commission's information about such exemptions and vaccinations. And similarly, there's a link to guidance provided by the College of Physicians and Surgeons of Ontario about medical exemptions. So that information is there for people to review. And we are strongly advising that anybody who is considering submitting an exemption request, they do so with guidance, either from their healthcare professional or from their doctor or their registered nurse, or from someone else who can also guide them through that process.
Somebody's asking about Synergy, and they have if they have trouble or assistance and need help with Synergy, and also that the college should give some help or some time if trying to get their medical documentation onto well whatever they need to do on Synergy. There's a question about the Synergy and getting help, and who should they contact for help?
So if I see the questions from Hofei. Hi, Hofei. The question, you can actually send it to your manager for the part-time employee, and to make sure that the part-time employee gets the information so that they can log on to the Synergy website. And it's taking Synergy roughly, they say 3 to 5 business days to process the request. In the interim, we continue to offer rapid testing on campus to make sure that people can still access the college premises. I did my Synergy Gateway submission and I got my confirmation back in about an hour and a half. So we're finding that they have a very quick turnaround time as well.
Do you want to go, Paul? Or okay, I'll go. Somebody's asking, I don't know if Alexa or Howard, about in the healthcare system, they understand vaccines, but they're not understanding why a college, but when your requirements put an ultimatum on the individual that affects their employment and their livelihood, then the ethical concern, oh, okay, sorry, maybe this is for Howard. So let me go back up. I agree with the requirements in certain environments, healthcare settings, but when the requirement puts an ultimatum on the individuals that affects their employment or livelihood, then there's an ethical concern comes into play. So I think they're talking about the ethical part. You might go back to asking, you know, if they don't get vaccinated, then that affects their livelihood.
No, I don't think I can really add anything to what I've already said. You know, the question is whether it's an appropriate or reasonable rule to put into place. It is. The question is whether it is appropriately implemented. That'll depend upon what particular mechanisms are put in place with respect to assessing your exemption request and ensuring your privacy. I don't think and as I've said, yes, it will have an impact upon your employment. Yes, it will have an impact upon whether you can go into a restaurant. Yes, it will have various other impacts, but it all has to be viewed within the broader societal concern with respect to the spread of what is a very significant virus and needs to be contained if we're ever going to return to something remotely looking like normalcy. That's something that I think we all want.
I would also add on to Mr. Goldblatt's comment there, particularly the last point he made. Across the country, some of you have heard me say this before. This disease has killed over 27,000 people. That's equivalent to basically wiping out our student population. We have about 27,000 students at George Brown College, give or take. So put into context, this is something we have to take tremendously seriously, not just as employers, not just as a college, but as society. And it really does require that all of us step up and step forward to do our part for the greater good of our community. Having individuals come on campus fully vaccinated is not only about their protection, but it's also about protecting other people who aren't vaccinated elsewhere in the community. Okay? And so it really does, I hate to be like a politician about it, but it takes a village to do this because this is killing people. And the latest data is showing that the people who are the most impacted and are in ICUs and who are getting the sickest are those who are not vaccinated. And as a leader and as an educator in this community, that's not something that George Brown is willing to stand by and just let happen. If we have access to and can facilitate access to the most powerful prevention tool we have available at this point in time, and that's vaccination.
Thank you. Just to be cognizant of time, we only have about 3 more minutes remaining in the session, and we will get to all the questions answered, or we will answer those questions for you. So I'm just going to jump to the next question that I have here, and this one is for Alexa. Are there studies documenting how statistically frequent side effects are for each of the vaccines in Canada?
So Canada actually has a very robust system of measuring the side effects of vaccine and vaccine safety. There have been over 54 million doses of vaccine administered in Canada. And of those, less than 1%, about 0.2% of people have indicated that they've had something which we might call an adverse event. Most people who have side effects have mild side effects like feeling unwell, having a sore arm, feeling achy or feverish for about 1 to 3 days after they have their vaccine. And then those side effects go away. In terms of how many people have adverse events that we would categorize as serious, it is, again, less than 1%. It's 0.008% of all of the doses administered across Canada at this point in time. And it's something that Health Canada continues to review and monitor.
Thanks, Alexa. There's a lot of questions, so I'm going to try to sum up there's a lot of questions about the rapid test. So I'm going to try to get a question in about the rapid testing. Why isn't the college allowing rapid testing after November 1st? Can people go get their own rapid tests after November 1st? And will the college continue doing rapid testing after November 1st? So there's a lot of questions around that rapid testing piece. So Chris, maybe you can jump in there.
Sure, thanks, Megan. Rapid testing will continue to be offered until October 31st on site. After that date, for individuals who have an approved accommodation, we will be working to ensure that they have full access to rapid testing so that they can come on campus in accordance with their accommodation. We will not be accepting rapid tests either provided on campus or off campus after November 1st. Our policy is clear in that in order to come on campus, you need to be fully vaccinated by November 1st. If the sequencing and timing of your shots are such that you don't get your second shot until later on in October, then you will only be permitted to access the campus once you demonstrate full vaccination.
Thanks. And somebody asked about the college determining their medical exemption. Please reach out to the union, whether you're faculty or support, and we'll chat about that. But thanks. I'm not sure, Paul, if you had one more.
I don't. That's 11:59, so we're coming to an end.
Oh,
so
somebody asked if we can have another session. We'll chat about that. Everyone, we have to respect everyone's time, and Howard and Alexa. That's why it's 45 minutes, and respectful of our and Chris's time here. So we will see. We'll talk again and try to see what we can do for sure. Thank you.
Yeah, and so I'm just going to wrap this up. I just want to thank everybody for coming out, for spending your time, for trying to get your questions answered. I know that there's a lot of unanswered questions in the chat that we will take note of and try to get answers for those questions for everybody whose questions were not able to be answered during this session. And as Megan mentioned, we may try to schedule another session, as this was had some very lively discussion. And I just want to say a special thank you to our expert panelists, Dr. Cataray, Howard Gorblatt, and Dr. Chris McGrath for spending their time, for answering our questions. And if you have any further questions, you need potential clarification regarding some of the impact of the new policy and the vaccinations, feel free to reach out to either local 557 or 556, and we would be happy to provide you with any guidance. So I just want to thank everybody for coming out. And I hope you have a wonderful rest of your day. Thank you, everyone.
Thank you. Have a safe day.
Thank you.
Thank you. Thank you, Alexa and Howard.
Thank you, everyone.
Thanks so much.
Thanks, Chris.
Thanks.
Thank you, Monique.
Thank you.
Yes.
Well, I shared this with Monique last week. Normally, if I'm speaking and Monique is interpreting for me, she's by my side. And only lately have I been able to actually see how she animates what I say. And sometimes her facial expressions are matching what I'm feeling on the inside sometimes.